The median nerve. Anatomy and palpation. The median nerve can be palpated along its length. In particular, key areas to palpate are at the wrist. The median nerve is involved in the very common carpal tunnel syndrome. The carpal tunnel lies distal to the wrist crease, and note here, a palpation is being performed by my thumb. The nerve can be also palpated at the elbow, where it lies medial to the biceps tendon. It's quite thick here, almost as big as the tendon, and it may be involved in bicipital tendinitis. Active quick test. If Claire extends her arm to a point where it hurts, and then if symptoms increase on wrist extension or lateral flexion of the neck away, we can infer that the symptoms are neurogenic. Even more refined testing can be performed if the clinician holds the arm in the position where symptoms emerge, and then wrist extension or neck lateral flexion away can be performed. Therapist assessment. The upper limb neurodynamic test 1. Claire lies close to the side of the bed. I've supported her arm, some weight on my thigh, and some weight taken through my hand. Note the starting position, thumb on thumb, and the tips of the fingers supported. The shoulder girdles are kept equal. They're stabilized. Step 1 is shoulder abduction to 100-110 degrees. Then wrist extension, supination, shoulder lateral rotation, and then elbow extension, checking the responses to each component. In that position, neck flexion or neck lateral flexion away will increase symptoms of the arm if they're neurogenic, and they'll be eased with neck lateral flexion towards the test arm. A variation can be performed using your elbow. This can really cradle the arm and provide support to someone who's a little fearful. The upper limb 1 position is carried out, and note in this position I'm performing some wrist extension and elbow extension as a mobilization technique. Therapist assessment. The upper limb neurodynamic test 1 reversed. This would be appropriate for a neurogenic problem at the wrist. Here we start at the wrist extension, supination, elbow extension, now whole arm lateral rotation. Note the arm supported on my thigh. Then I'm going to support the shoulder girdle and now abduct the arm. Therapist assessment. Upper limb neurodynamic test 2. The patient lies over the side of the bed, so their shoulder girdle is just over one side. Shoulder depression, elbow extension, whole arm lateral rotation, and then note the hand grip here, wrist and finger extension with my thumb between the web space. In this position, structural differentiation can be performed by releasing the shoulder girdle. Therapist assessment. The upper limb neurodynamic test 2 in a seated position. Many people prefer this. You can look at the patient, and it might be more supportive for a patient who's anxious. Shoulder girdle depression, whole arm rotation, still that same thumb in the web space position and wrist extension. And here I'm performing a gentle mobilization in this position. Another gentle technique in this position would be to perform shoulder girdle depression and at the same time get the patient to point towards their face. Similar techniques here too. Note here, shoulder girdle depression and wrist flexion. That's a slider technique. And here's a tensioner technique, wrist extension at the same time as the shoulder girdle is depressed. You can make up your own techniques here. Passive techniques. The upper limb neurodynamic test 1 as a slider and tensioner. In this position, notice how as I extend Claire's arm, that her shoulder girdle protracts. This is a common finding in patients who have neurogenic problems in the arm. In this case, as the shoulder girdle begins to protract, I'm just going to flex Claire's wrist. It's a slider technique and a way of increasing confidence in the arm movement. Passive techniques. We call this the nana arm wobble. Here I'm encouraging Claire's shoulder elevation, trying to get her to relax and let the arm flop, exploring different positions, and you can note that as the arm elevates, that if it's flopping, the wrist can also flex. It's a slider technique. Passive techniques. In upper limb neurodynamic test 1, glenohumeral mobilization. Here's an example of joint mobilization in a neural load position. Claire's arm is supported in the ULNT1 position, and I'm performing glenohumeral mobilization techniques, whichever is appropriate for the particular patient. As a further progression, the techniques can be done in more neural load. Here is a distraction technique. Here's a glenohumeral movement, and note, to place more load along the neural system, I've asked Claire to extend her wrist as well. Self-management, gentler movements, balloon patting. The act of balloon patting creates a supination, a little wrist movement. It's a gentle way to get going. Self-management, gentler movements, the ball throwing progression. A ball thrown underarm is a median nerve mobilization, but it's also carried out in a distracted, fun way. An overhead throw is a more aggressive neural mobilization of the median nerve. And catching a ball thrown high is also a progression of the same technique. The patient can do it at home by throwing the ball against a wall. These are functional exercises and provide a good distraction while mobilizing. More gentler movements. We call this the no more dishes technique. Get the patient to imagine that while they're doing it. It might give them a little more control. Gentler movements. Watch the watch. If you place your watch on the volar aspect of the forearm, every time you look at it, you'll be performing part of a median nerve mobilization. Gentler movements. Using a yo-yo. Claire here is trying to use the yo-yo, but if you note, it's also a way of mobilizing the median nerve. It's a gentle technique, it's a bit of fun, and it'll probably work best in somebody who has used a yo-yo before. Self-management, gentler movements, juggling. Juggling is a great way to mobilize the median nerve. By the time someone's good at juggling, it mightn't be much use. Self-management, gentler movements. We call this Zorro. I've asked Claire to imagine she's holding a sword and she's slicing through the air. The slice can be in any position, a Z or a number. Self-management, gentler movements, Sawatika. A great way to mobilize the median nerve in a distracted, fun and functional way. Self-management, gentler movements, free the bird. Imagine you're holding a bird and letting it go. Let it fly away, and the median nerve is beautifully mobilized, and the metaphor allows some distraction. Self-management, stronger movements, We call this the busy bee. Note how the hands are held together, and then in big figure of 8 positions, the limbs can be taken low, to the left, right, and now high. It doesn't hurt to get the patient to make a little bit of a noise at the same time. Great for carpal tunnel syndromes. Self-management, stronger movements. A wrist stretch. Here I've asked Claire to use one arm to treat the other arm, to extend the wrist and reach up to the sky. The same technique can also be performed focusing on individual fingers. This will provide an intrafascicular mobilization of the median nerve in the hand. Self-management, stronger movements in a rock around the clock technique. Get the patient to push her wrist to the various points of the clock. The higher you go, the more aggressive the technique will be. It may suit some of the older patients. Self-management, stronger movements, balancing. Here Claire's sitting on a bed and balancing, and if you notice, as her wrist extends, the shoulder girdle lifts up. It's essentially a slider mobilization. But by using balance, it's distracted, perhaps a little more fun. A balance cushion even makes it more aggressive. It brings in more spinal movement and more balance challenge. Self-management, stronger movements. Crawling. The act of crawling is a nerve mobilization. Look at Claire's upper limb. As she extends her wrist, the elbows extended, and the neck flexed, that provides a functional way to mobilize the median nerve. Self-management, stronger movements, a wall stretch. With a hand placed on the wall, and thus wrist extended, elbow extended, Claire can turn her whole body away and mobilize the whole nerve complex. Self-management, stronger movements. Look at your hands. A favorite technique, simply looking at your hands as you open them up, is a great bilateral nerve mobilizer.